Hi, my name is Laura Phillips. I'm a senior neuropsychologist with the Child Mind Institute, and today we're going to hear from an adult who has concerns about her young niece's progress with reading. She asks, I've noticed that my niece, she's 5, has a hard time learning the ABCs and never really seems to recognize rhymes when we play a rhyming game. She also sometimes mixes up some parts of the words, like saying aminal instead of animal. Are these signs of dyslexia? She's just starting to learn to read, so maybe some of this is normal, but I'm not sure. Are there other signs I can look out for? So this is a great question from a concerned aunt, and the answer is they can be risk factors or warning signs, but they may not necessarily be. We know that dyslexia is a language-based learning disability. We know that difficulties with language learning early on and speech sound development can be risk factors, certainly for dyslexia. So some of those early warning signs or early risk factors that the parents might be able to point to early on are really difficulty with language-based learning. So difficulty building a vocabulary, difficulty learning and remembering the names of objects, difficulty retrieving people's names. But some of those other early risk factors include things like difficulty remembering nursery rhymes, difficulty recognizing words that rhyme, difficulty producing rhymes, difficulty remembering those sequences like the alphabet, the days of the week, the months of the year, these early concepts that are often taught in nursery school in the context of some sort of jingle or rhyme. But kids, even with those rhymes, sometimes have a hard time remembering it. So according to the DSM-5, technically you can't really make a diagnosis of a specific learning disability with impairment in reading, which is a very long way of saying dyslexia, until the child has had the opportunity to have formal reading instruction. So even though you might not be formally diagnosed with dyslexia at that point, you certainly can identify some early warning signs that might suggest a need for some additional support. We know that early intervention is really, really critical. The earlier that students get the right type of instruction, the less likely it is that their difficulties will persist. There's actually a really important statistic showing that kids who do not start to get formal reading instruction by the end of first grade are much more likely to show a pretty significant gap in their reading that persists into high school. So we do want to make sure that as soon as those early warning signs are recognized, that kids are starting to get help. To learn more about dyslexia, visit childmind.org.